Glycoprotein 2b3a antagonist. These are the drugs which are used to reduce the or inhibit the glycoprotein 2b3a receptor. Let me discuss in detail. Contents, definition, mechanism of action, pharmacokinetics, adverse effects, contraindications and uses. Glycoprotein 2b3a antagonist. So this glycoprotein 2b3a receptor usually binds the fibrinogen and it will activates the platelet activation. How means? So this glycoprotein 2b3a receptors will bind the fibrinogen and converts the fibrinogen into fibrin, final step of clot formation. So by these glycoprotein 2b3a receptor antagonist or the agents that inhibits or block the activation of glycoprotein 2b3a receptors. That means very simple, these glycoprotein 2b3a antagonists are the agents which reduces or inhibits the action of glycoprotein 2b3a receptor. So this glycoprotein 2b3a receptor is important for the activation of the platelets. Example, abciximab, eptifibatide. Let me discuss about the mechanism of action of abciximab. So this abciximab will bind the glycoprotein 2b3a receptor. So usually this receptor is present on a platelet. After binding this receptor, it inhibits the activation of the glycoprotein 2b3a receptor. So due to inactivation of this receptor, it prevents the binding of fibrinogen, binding of glycoprotein 2b3a receptor to fibrinogen. So due to inhibition of binding of fibrinogen, it inhibits the conversion of fibrinogen into fibrin. So this fibrin is a final step, the formation of thread-like structure for the clot formation, so that it reduces the formation of clot. So usually glycoprotein 2b3a receptor will bind the fibrinogen and it converts fibrinogen into fibrin, then it forms clots. So this abciximab drug will bind the receptor and inactivates the receptor so that it prevents the binding of glycoprotein 2b3a receptor to fibrinogen, so that it inhibits the conversion of fibrinogen into fibrin. There is no formation of thread-like structure or clot formation, so that this abciximab will reduces the formation of clot. Pharmacokinetics. So usually this abciximab is administered parenteral route, that is intravenous route, and it is metabolized in liver and excreted through urine. Adverse effects. So usually it causes the bleeding. So why it will cause bleeding? Because it affects the platelets. So when it will affect the platelets, obviously there is no clot formation, because for platelets will usually helps to formation of clot if excess bleeding will be happen. So due to inhibition of the platelets, there is a increase in a bleeding in case of bleeding disorders, not with everybody. If the person have bleeding disorder or recent surgery, so in that cases it will increases the bleeding. And also it causes thrombocytopenia, low platelet counts, because it inhibits the platelet action. And also it causes hypotension. So why it will cause hypotension means, so usually it causes the pericardial sac bleeding. So due to that pericardial sac bleeding, uh, there is a decrease in a blood pumping, so that it causes the hypotension. So due to the hypotension, it also causes bradycardia, slow heart rate. Contraindications, when we should avoid, because in case of bleeding disorder, so if the person have bleeding disorder, we should not go with the abciximab, or we have to take a necessary precautions. And also we should avoid in case of recent surgery and stroke. So in case of recent surgery, so after surgery, you know that blood vessels will be damaged, usually bleeding will happen. So to avoid the bleeding, they used to give the platelet drugs, means the drugs which are used to stop the bleeding. So in case if they're given this antiplatelet drug abciximab, so it will be a contraindicated, so that we should avoid in case of recent surgery and also in case of stroke. Uses, it is used in the treatment of coronary angioplasty, unstable angina, stent application and coronary thrombosis. Thank you.